Many years ago, when I worked in direct service, I got a call from St. Michael's Hospital referring a woman to me. She came to my office and asked, "Could you leave me alone in your office for 30 minutes? "Why?" I asked. She told me she had been diagnosed with HIV a couple of weeks earlier and just hadn't had a chance to cry. She was living in a shelter and was never alone. I gave her the time. We didn't talk that week, but she promised to return. I realized that the reason they had sent her was very different from the reason why she came. Year after year, I saw the same situations and heard the same stories. Something needed to be done. A colleague and I got together and created a research project to look into the real needs and priorities of women living with HIV. We thought it would take a few months. It took 6 years. It turned out the women were not interested in discussing research priorities. They just wanted to talk. Many of them had never spoken to anyone about their HIV status. They talked about daily survival, lack of food, affordable housing, transportation, and access to health care. They talked about stigma and discrimination, not just for being HIV positive, but also for being Black, Aboriginal, of ethnic minority origin, being female, queer, or transgender, being poor, ex-prisoner, for involvement in sex work or drugs. They talked about violence in their lives, reproductive health issues, treatment, and how it changed how they looked, and the impact of all these issues on their mental well-being. It was really exciting, but also very difficult. When I hear their stories, I am really frustrated. Women are struggling with the same issues as 20 years ago, complicated further by the long-term use of treatment. And the worst part is the knowledge that has been generated so far has had little impact on the lives of women living with HIV. As a researcher, I am disappointed in the past, but excited for the future. As a Black woman, I feel the pressure of expectations from my community and the women I work with to make a difference in their lives. As a community leader, I hope to influence policy and practice and make a difference in the lives of women. We owe it to them.